Hi, this is day 2 of the Project Directors Conference. Just came back from a session, legislative landscape session given by Patricia Leahy, the legislative director of the National Rehab Association. She talked about 3 things: sequestration, transition, and speaking with one voice. Sequestration is a fancy word for automatic funding cuts. And apparently they're going to go into effect, if Congress doesn't act by the end of the year, they're going to go into effect immediately, January 2nd, 2013. It's about $1.2 trillion that is going to be cut across the board, with the exception of Social Security, Medicare, Medicaid, veterans, possibly defense. So this is a 7-point-something% cut. It could go as high as 14. VR is going to be impacted, or could be impacted, if Congress doesn't act. Title I could be cut, even though it's a mandatory funded title. Everything else is discretionary, but still could be cut. So what she's saying is any data to Congress is important, particularly return on investment. Duplicating programs is usually a sign that things could be changed or cut in effective programs as well. Second thing she talked about is transitioning. Apparently a GAO report indicated that that Department of Ed, Department of Labor, and Health and Human Services, very little collaboration amongst those agencies. Pat said that that's not as concerning as that there's an effort to get our transition program sort of separated from the VR or the Rehab Act. And so what she calls it is schools get the first dollar, VR gets the last dollar. In other words, if transition is going to go its separate legislative route, then VR is going to be in a position where they are not helpful to students or youth with disabilities. Let's see, she did say that the one-stops don't duplicate the VR services, but they are a good referral source to VR because their staff is not as skilled in disability issues. And the third thing she talked about was speaking with one voice. A lot of VR counselors are retiring, they're going over to the VA, or they're going to private rehab, and that fragmenting is preventing the field of rehab counseling from speaking in a strong voice to our legislators. And then finally, she did mention that more than 11 million people, eligible people with disabilities, are served by VR. And that the statistic that we're aware of, that for every dollar spent on consumers, 7 goes back to the United States Treasury. One session was called Maximizing Your Resources Through Learning Communities, and the speakers were addressing the value of forming communities of practice where people with shared interest can come together to talk about their topics that they're interested in. That's exactly what we do at VocRehabRadio.com, especially in our forums. So go over to VocRehabRadio.com/forums, and you'll see a VR structure already in place where you can talk about disability issues, legislation, education. You can build your own content as well. You can form groups. You can upload documents, pictures, things like that. You can ask questions, answer other people's questions, and the best part is it's archived. So once you come back, you can do a keyword search, see if anyone has already posted on the question you have, and you can get your answers just by searching. That last session is called Community Colleges, Entree to Baccalaureate, Employment, and Beyond. There's actually a panel of speakers, and the first speaker talked about, in general, students, the benefits that they might receive from a community college, such as the affordability, small classes, qualified faculty, it's usually close to home for students, and that they also offer diverse support services. But then she also mentioned a few things about students with disabilities, such as the difference in moving away from secondary school to post-secondary higher education, and how students with disabilities must advocate for themselves. She did give some advice. She said start early in planning, communicate, collaborate with people, and that once again she reminded that college is not K through 12, and that there's going to be some fundamental differences, and a lot of times students are not prepared for that. The second speaker spoke about just general transition issues, but there was a few things I wanted to mention. For example, disability documentation. She did say at this Virginia community college that the IEPs cannot be used as evidence, and so you really must know the specifics of the particular college you're seeking out. And so what they recommend is go to the website of the college, go to Disability Support Services, and read about the documentation that's required about navigating campus, not only the grounds, the environment, where the stairs are, where the elevators are, things like that, but also the classrooms. You know, what do they look like? Are they hot, cold? Where are the vents? What's the lighting like? As you go early, do a dry run, go to your classes, see how long it takes you to get from point A to point B if you have multiple classes back to back. Last day of the conference, just 2 sessions. First one was on the Affordable Care Act and people with disability. The speaker was quick to note that this is not legislation about disability specific. It's about expanding coverage to people who don't typically have health care coverage. But it's also changing how we share information. So the speaker talked about information, infrastructure, and incentives. Notice how they always have three components. They simplify it, and they always have it with the same letter, like the 3 C's, the 3 I's. Well, this time it was I's. I do appreciate that, because once you get to 4, I'm not thinking well. One of the problems or things that we need to consider is that some lower income individuals may not have access to computers, but they have smartphones, and it takes a different infrastructure to push the information to smartphones. This is a single streamlined application to health insurance. So the application is going to be online, and states can choose to use the federal application or build one their own. Right now what they're saying is they don't know how to identify disability and how that's going to impact the kind of coverage or care that they receive. For example, SSI, SSDI. Is what they're asking for is income. The IRS is going to be involved with this now, and they can link up with Social Security Administration. The Indian Healthcare Improvement Act has been expanded to include mental and behavioral health. Exchanges, something called exchanges, need to be developed. These are one-stop marketplace to get information on private health insurance. These exchanges need to be built at the state level, and many states have not begun to do it. A couple resources that she shared. Healthcare.gov is a federal resource for getting information on health insurance, and state specific. She did share Illinois, which is Illinois Health Matters, but you know, naturally, if you're not from Illinois, that's not as helpful. And the last session of the day and of this Project Directors Conference, someone from the National Institute of Corrections spoke about, in general, corrections and how it works, and some statistics. In 2008, it looks like 1% of adults was behind bars in America. That when you consider incarceration of people in prisons, when you consider probation and those paroled, we're now looking at 1 out of every 31 people were under some form of correctional control. That employers cannot ask about arrests. They can ask about criminal convictions. The EEOC, Equal Employment Opportunity Commission, came down hard and said employers cannot have a blanket policy that excludes applicants with criminal records. When people talk about their convictions, and that they just briefly, in as few words as possible, state what the crime was, like, oh, you know, assault. And yeah, I mean, that's very brief, and then just quickly move into what they've been doing proactively since the conviction. Related to that, she did say that there's a movement called Ban the Box, and that employers are kind of stopping the practice of asking on an application if you have what your criminal history is. You know, check this box, kind of thing. That concludes this conference. I'm waiting for my flight out of here, but 15th Annual Project Directors Conference, pretty good, and if you can make it, thumbs up.